Yes, I'm a medical oncologist by training. I've been a scientist, particularly working on experimental therapeutics, and my scientific interest focused in the last years on GI cancer, particularly colon cancer, and more recently on pancreatic cancer. And at the same time, I am the scientific director of Istituto Pascale, which is a comprehensive cancer center with a dedicated multidisciplinary oncology group focusing on pancreatic cancer, including both people involved in care for pancreatic cancer patients, as well as researcher working on pancreatic cancer. I joined PCE because I think multidisciplinarity and also engagement of different stakeholders for such demanding disease is very important, and also because through PCE I think I could improve my capacity to tackle these challenges, interacting with different stakeholders, and particularly with patient organization and caregivers, which usually rarely we can meet during your day-by-day life in such a comprehensive cancer center. So far, it was good. I was involved in one of the pancreatic cancer day, discussing with other expertise and other representative of different stakeholders about this. I was also part of a multi-stakeholder meeting organizing within EU-funded project with a specific project on pancreatic cancer that we recently joined as a partner, and I hope to improve my participation in pancreatic cancer activities, not only as individual, but what we are thinking, since I'm the scientific director of the Institute, to make the Institute as a partner of PCE. I think this will improve our involvement in the activity of PCE. The biggest challenge in pancreatic cancer, if I say, at least are several. One of the most important is early detection. We are still far away to, we have no screening capabilities, and the the symptoms are not so clear at the beginning. There is a lack of awareness on these kind of tumors, this kind of sign, and so on. So we need to push people in this regard for awareness and research toward the early detection approach. And the second major challenge is related with biology of pancreatic cancer, and the fact is that for the particular biology of pancreatic cancer, it's quite resistant to systemic treatment, as well as is for its morphological and anatomical side, it's also very challenging in terms of surgery removal. Of course, first of all, in terms of awareness on this disease, I think this is one of the mission of Pancreatic Cancer Europe can make a lot. The second thing that pancreatic cancer can do is to put together different stakeholders, make them and favor exchange of opinion, and to increase the interest and the focus of different stakeholders, not only researcher or health professionals, but also politicians, institutions, as well as patients and caregivers, to address the challenges related with this disease. I think this is one of the main focus. Yeah, slowly, but at least compared to a few months or years ago, there are some lights at the horizon. This comes from some results, for example, on the immuno-related approach to pancreatic cancer. There are quite interesting data on the use of vaccine approach at the moment in the adjuvant setting with some interesting results. There are data also on the mechanism of resistance of pancreatic cancer to immunotherapy. There are several results coming out from this. And I think one of the most promising things is that I was at the American Association for Cancer Research meeting last April, and I think the pancreatic cancer was one of the stars of the meetings, with a lot of presentation abstracts on different point of view, and with some of the challenges that we were talking about. So the problems of early detection, the best understanding of the biology of pancreatic cancer, the immunotherapy approach, novel therapeutical approach, and so on. So there is, at least in the research ecosystem in the world, there is quite an interest and an awareness on the challenges of this disease, and also on the importance of work to address these challenges and to cure pancreatic cancer patients, because incidence is growing up, age of this disease is lowering down, and so it's becoming a very important problems for our health system, for our society. I think in the US is the third cause of mortality for cancer, and so we should work a lot, and this is what we are doing so far as a community of researchers. The messages should be what I said just a few moments ago. So we are aware of the challenges of this disease, at least as a researcher, as a physician, as a health professionals, and we are doing as much as we can. And at the end, research pay out. I mean, we are seeing results that can turn on the lights and at least design a way to address some of the challenges related with the disease. We should work a lot, and your organization can do a lot, and we want to work together as a community with other stakeholders, and PCE can represent the ecosystem in Europe for at least in part for this objective.